Hello, everyone. Thank you for joining today's facility-based preview live demo and office hour session. CMS will provide an overview of the facility-based measurement for the merit-based incentive payment system in 2019. Conduct a live demonstration of the facility-based preview and answer frequently asked questions. After the presentation, CMS will take your questions about facility-based reporting as time permits. Now, I will turn it over to Adam Richards, Health Insurance Specialist in the Centers for Clinical Standards and Quality at CMS. Please go ahead.
All right, well, thank you, and greetings, everyone. Thanks for joining us today. We're excited to be hosting this webinar because this is the first time we get to talk to you all specifically about the new facility-based measurement option under the merit-based incentive payment system for 2019. We have a good mix of policy review as well as an actual demonstration of the facility-based preview feature on qpp.cms.gov. So we hope to be able to cover quite a bit of ground and really all of the areas of this option that may be of interest to each of you. Of course, we'll have an open question and answer session toward the end of the call, and we'll do our absolute best to address your questions or concerns. And of course, we also welcome feedback too. Just a couple of housekeeping items before we get started. Again, we'll do our best to cover as much as we possibly can today, and we will have that open Q&A session toward the end. I will note that the slide deck recording and transcript of this event will be posted in the webinar library on the Quality Payment Program website within the next 2-ish weeks. So be on the lookout for that. One way to certainly be informed of when we post that is to sign up for our listserv on qpp.cms.gov. It's a fairly simple process. Just navigate to the site, scroll down to the bottom, and enter your email address, and it'll keep you up to date with all things Quality Payment Program. One other note that I'll mention today is we're not going to dive deeply into the actual Mips requirements. We do have some really great resources available that we'll cover a little bit later, but I'll also mention we did a Mips 101 as well as an Alternative Payment Models 101 webinar a few weeks ago. Both of those recordings are available, and I highly encourage you to check those out if you're just getting started or need a refresher on some of the information. Okay, let's charge forward. I'm going to move to slide 3 just to talk a little bit about the topics of our discussion today. So as we do with all of our webinars, we'll start with a little bit of an overview and background of the Quality Payment Program and certainly the Merit-Based Incentive Payment System. Then we're just going to jump right into our facility-based measurements, talk a little bit at a high level of where it came from, what it all means. We'll go through eligibility, some of the data submission requirements, but also take a look at the impact on quality and cost scores. We'll also cover scoring as a piece of that as well. Then we're going to shift gears a bit, stop talking as much about policy and more with an actual live demo of the facility-based preview feature about halfway through our presentation today. We'll wrap up with our resources and technical assistance, and then, of course, we'll get into our open Q&A session. Okay, so moving forward, just talk a little bit about Quality Payment Program and Mips in general. I'm on slide 5. So as a refresher for those on the line who have participated over the last 2 years, or for those who may be newly eligible and just experiencing Quality Payment Program for the first time, what you see on screen is the general structure of the program. We are required by law under the Medicare Access and CHIP Reauthorization Act to implement the Quality Payment Program, which, as you can see, consists of both the Mips track as well as the Advanced APMs track. Again, we're not going to get into too much on both of these tracks today, so highly encourage you to take a look at some of the resources that we do have available. Our focus today is going to be on Mips, but more specifically facility-based measurements. So before jumping in, I do want to review a couple high-level elements of Mips that will really help with the rest of our discussion. So moving forward to the next slide, on slide 6. I think this is an important slide because, as you can see on screen, Mips is comprised of 4 performance categories. All 4 of those categories add up to 100 final points. We will assign a final score to each Mips-eligible clinician, and that final score can range anywhere from 0 to 100 based on performance. What we then do is compare your final score to what we call a performance threshold, which is essentially the minimum amount of points that a clinician would need in order to avoid a negative payment adjustment. So comparing the final score to the performance threshold will determine if the clinician for the performance year receives a positive, a negative, or a neutral payment adjustment. And since we're in 2019, that payment adjustment would apply to the 2021 payment year. And just so you're all tracking, the performance threshold for the 2019 performance year is 30 points. So you must receive at least 30 points in order to avoid a negative payment adjustment beginning in 2021. So while I like this slide because it really calls out the performance categories very well, and while we are going to focus a little more specifically on the first two performance categories today with our discussion on facility-based measurement, just know that all of these categories are important in helping us move toward value. Jumping ahead to the next slide, I think this is generally helpful. Just again to provide a bit of context around some of the acronyms and key terms to know, we will reference TIN and NPI. Again, that's your taxpayer identification number, the TIN. Your NPI is your national provider identifier. Also at the bottom of this screen, which I think is helpful because we were just talking about the cycle that we are on for the program. And as you can see with each performance year, what we have listed on the left-hand side of the screen corresponds to a payment year. So, for example, we are in 2019, the 2019 performance year, and the payment adjustments will correspond to the 2021 payment year. And, of course, that could be up to a potential positive 7% incentive for higher performers, but please do remember that this is a budget-neutral program. I always like to keep that in mind and keep flagging that as we go on in our performance years and with the program. So with that, I'm going to turn it over to Molly McHarris, our Mips program lead, to talk a little bit about facility-based measurement. Molly?
Thanks so much, Adam, and thank you, everyone, for being here with us today. So I'm just going to go over at a high level what facility-based measurement is, and then I'll be turning it over to my colleague, Dr. Nilasina, to talk through the scoring details. And then, as Adam mentioned, we will have the opportunity to actually see a demonstration of the facility-based preview, which we feel will provide a lot of additional clarity to the benefit and of the facility-based option, and will really help inform all of you as well as your colleagues and other stakeholders who may be interested in facility measurement on understanding in a little bit more detail what it really is and whether or not this is the option you want to pursue for your Mips performance for this third year. So let's jump right into slide 9 for a brief overview of what is facility measurement. So to start with, what is it? Why are we here? So facility-based scoring, it's an option that is available for clinicians beginning in the third year of the program, so calendar year 19 this year. We did finalize this policy in the 2018 rulemaking cycle, but there were some additional details that we needed to add in. So this is the first year, again, calendar year 19, that facility-based measurement is available for MIPS-eligible clinicians. And what facility-based measurement does is it applies the usage of certain scores for certain types of clinicians who work at hospitals for the quality and cost performance categories. So remember, for facility measurement, it really just applies to the quality and cost performance categories. If you are still required to participate in the improvement activities and promoting interoperability performance categories, you would need to do so separately and outside of the facility measurement approaches we're discussing here today. If folks have any questions on any of that, happy to talk through that in more detail during the Q&A period. So let's go ahead and jump to slide 10 to start talking through the eligibility determination. So this is how we determine whether or not you as a MIPS-eligible clinician would be eligible for facility measurement. So again, remember, to be a MIPS-eligible clinician in this first year, you have to be considered an eligible clinician type, so physician, physician assistant, et cetera, as well as the new eligible clinician types we added this year, occupational therapist, physical therapist, et cetera. And then you would otherwise have to be considered to be MIPS eligible, meaning not otherwise excluded, due to our 3 exclusions, being newly enrolled to Medicare, if you significantly participate in an APM, and then the low volume threshold Again, we're not getting into details into any of the Mips eligibility basics or those exclusions here today. If folks do have questions on any of those concepts, we have a lot of information on our website, cpt.cms.gov, on those available resources. So to start with, on whether or not you'd be eligible for facility measurement, you'd first have to be considered to be a MIPS-eligible clinician. Then we will look to see whether or not you as an individual, so for you as a unique TIN NPI, have had 75% or more of your covered professional services associated with 3 place of service codes. And those place of service codes are 21, 22, and 23, which is inpatient hospital, on-campus outpatient hospital, and emergency room. Then we will look to see if you had a single line service filled with the place of service code 21 or 23. So again, that's for the inpatient hospital or emergency room. And then we look to see if both of those things are true, if we can attribute you to a hospital that participated in the hospital value-based purchasing program. And we have a note here on the slide that talks about the time frame that we have used to make these determinations. So as you can see, we are using historical data with the claims run out. As with everything under the quality payment program, we really want to ensure that MIPS-eligible clinicians have as much information as close to the beginning of the performance period as possible, so you all can make informed decisions on how you want to participate in the program. So that's how we do the individual determination. To move to the group determination on the next slide, slide 11. So to determine this for groups and virtual groups, we look to see if 75% or more of the group or virtual group's NPI meet that individual designation I just went over. So again, that's 75% of the individual services are attributed to those 3 place of service codes, 21, 22, 23. There also is a single line service for 21 and 23. And then again, at the group or virtual group level, we would want to see that the entire group has 75% of their NPIs meeting that threshold. And again, we will attribute clinicians to groups and virtual groups to the hospital where the plurality of clinicians is greatest. I do also want to note that facility measurement is not applicable to clinicians who are participating under the MIPS APM scoring standard at this time. If you are one of those clinicians, we would refer you to the instructions and guidelines for your particular MIPS APM. Okay, so that's the basic eligibility information. So let's move on to slide 12 to talk through a little bit more detail how we attribute you to a hospital. So we will assign you, the individual clinician, to a hospital based off of where you provide the most services to your patients. So, for example, if you are a clinician and you have, if you perform services at multiple hospitals, if you perform the majority of your services at one hospital, that is where we would attribute you to. The same concept would apply for group level attribution. So we would look to see for the majority of the group where the majority of their clinician services are attributed, and that is the hospital we would assign you to. We also, of course, are looking for hospitals that have participated in the hospital value-based purchasing program and have a hospital value-based purchasing score, so we can then assign that hospital value-based purchasing score associated with the hospital to you, the clinician, or to the groups of clinicians. For the question on the slide here, this is one that we've commonly received since we've released this option, which is how do we attribute the facility-based score to a TIN where the TIN is an independent group contracted by the hospital. And so what we do in those scenarios is we use the CMS certification number, the CCN, supplied in the subcontracted group claims to attach the subcontracted group TINs to the hospital they serve. We recognize that this is a scenario that can occur across the country, so wanted to make sure that folks are tracking to what we would do in this scenario. Okay, let's go ahead and move on to slide 13 to talk through in a little bit more detail our attribution. So how do we identify the hospital to which you've been attributed? We'll be going over this in more detail during the demonstration for the rest of the presentation, but you can also look at this through the lookup tool. I think everyone is familiar with the lookup tool, but if you're not, it's our tool that's available at qpp.cms.gov, where you can enter your NPI, and it would reflect back to you whether or not you are a MIPS-eligible clinician and if you have a special status associated with you. If you are considered to be facility-based, you would have a facility-based special status associated with you, as well as the attributed facility. And so moving on to slide 14. So now that we've talked through how you are eligible to be facility-based, how you are attributed to a hospital, the next common question we receive is, how do you sign up for facility measurement? The answer is that you do not have to sign up for facility measurement. What we will do is we will take a look at your performance under facility-based measurement. Again, if you are a MIPS-eligible clinician that is facility-based and we can attribute a hospital to you, we will automatically assign the hospital value-based purchasing scores that are transformed using our transformation algorithm to the quality and cost performance categories. If those scores are greater than your performance would be under any other separate data you've submitted to us for quality and cost, then we will use the facility measurement score. If, however, your performance is greater, meaning at a higher performance rate under the quality and cost performance categories via separate data submission, so let's say you don't want to do the facility option, you still want to work with your third party, such as your QCDR, to submit measures to us. If your performance is greater based off of that data that is submitted, we will use that score instead. And again, I recognize this can be a little bit abstract, so that's why once we talk through the rest of the policy background here, we will be giving you all the demonstration on what the facility-based preview looks like, so you can make an informed decision based off of your historical performance of your facility that you're attributed to on whether or not this may be an option you want to pursue. So at this point, let me go ahead and turn the presentation over to Dr. David Nilesina to talk us through measurement and benchmarks and scoring. David?
Okay, thanks, Molly. So on these next few slides, we'll talk about once you've been determined to be facility-based and have been attributed to a hospital, how we will actually calculate your MIPS category scores using that determination. So first, in terms of the measurement, CMS will use all of the measures from the hospital value-based purchasing program for the specified program year in order to calculate the quality and the cost performance category scores for those who are determined to be facility-based. So we didn't pick and choose. We used the entire set of the hospital VBP measures. We will then calculate the facility-based quality and cost scores using the total performance score calculated under the hospital VBP program. And for this first year, the 2019 performance year for MIPS, we will be using the fiscal year 2020 data and score for the hospital VBP program. We will then map that score to the QPP data for 2019 in order to get the category scores, and I'll talk in some more detail about that on the next few slides. The benchmarks that will be used to determine the total performance score are the same ones that are used for the hospital VBP program. So we won't be creating separate MIPS benchmarks. We will just use those that are already incorporated into the total performance score for hospital VBP. Next slide, slide 16. All right, so then the first step is that we will look at all of the hospital VBP scores and the distribution of those scores. And for the attributed hospital, for the clinician or group, we will determine the percentile where they fall in the percentile distribution for all the hospital VBP scores. We will then use that percentile to map to MIPS scores. So in this example, the facility-based clinician's total performance score for their attributed hospital is 60% This corresponds to the 80th percentile among all of the hospitals in the BBP program. And so we use the 80th percentile as we move forward to determine their Mips score. Next slide, slide 17. All right, so then we take that 80th percentile and we independently map that to the distribution of scores for non-facility-based clinicians for both the quality and the cost category. So in this example, for the quality category, the 80th percentile corresponded to a score of 55%. So the clinician would get a category score of 55% for quality. And then for the cost category, that same 80th percentile would correspond to the 66% for cost. And so their score for cost would be 66. So we do these independently for the two categories, but we use the same starting percentile that's derived from the hospital BBP distribution. Next slide, slide 18. Now, it's important to know that some hospitals do not receive a total performance score under the hospital BBP program. There's a number of reasons. So first, not all hospitals are included in the program. For example, critical access hospitals are not included. There are also some data requirements that have to be met for the hospital to get a score. And then there's some other circumstances that would exclude the hospital from that program. So if the hospital does not have a BBP score, and that's the hospital that the clinician or group is attributed to, they would not be able to have a facility-based score under Mips, and they would be expected to submit data for the quality category on their own in order to get a score for that category. Next slide, slide 19. All right, so that's the end of the scoring section. I will now turn it back over to Adam to introduce the live demo.
All right, great. Well, thank you so much, David and Molly, for walking us through the policy pieces of facility-based measurements. Seeing some really great questions, and we'll get to those in just a few minutes. But at this point, we do want to walk through the facility-based preview live demonstration. So it's my pleasure to turn it over to Sarah Kelly, our Scrum Master for the Submission Feedback User Interface.
Good afternoon, everyone. I'm going to be showing you the facility-based preview experience on the QPP site. Right now, you should be able to see my screen, and we are at the account home dashboard. This may be a screen that's already familiar to you. This is where you can navigate into feedback and submission during those particular windows, but also this is the place where you can navigate into the facility-based preview. There's two different ways to navigate into this system. You can navigate using the dashboard itself and the button that is associated with facility-based preview here on the right, or you can use the left-hand navigation, and you'll see that there's a link that's associated with facility-based preview here. Upon clicking on that button, it's going to take you to all of the TINs or groups that are associated with your user. You're going to be able to then click on the TIN that you'd like to look at their facility scoring. And so we can go ahead and do that by clicking on the button titled Preview Score. Upon clicking on that button, you're going to see the TIN and its associated NPI. So you can see here for this particular group or TIN, there's no facility-based preview data available for that practice. So this is the messaging that you're going to see in that scenario, whether it is a group or an NPI that we're referring to that does not have data available. We are going to take a look at a particular individual, this NPI here, and in order to see their details, you're going to click on the button here to the right that says Preview Individual Score. Upon clicking on that button, you're going to be directed to the facility-based score preview, and this is all of the information here in just this one page. We have a nice, useful feature for you for your records. If you want to maintain this for yourself, a really nice way to do so is to utilize this print button here at the top right. you simply click on that button, and it brings up your browser's native ability to either print the page or save as a PDF. So I would just click on this button here, Save, and then I could save this for my records, and that would be useful if you needed to contact the help desk or anything along those lines. You can see at the top the NPI and the TIN that are associated with this particular individual, and then we can dig into the details. So at a high level, just like was just discussed, what we do is we take those percentiles to do the crossover between the facility score and the QPP scores. We focus just on the two categories, quality and cost, which are associated with hospital scoring. And you can see here for this particular user, the HVBP score of 54.84 out of 100 is associated with the 80th percentile. If you have some questions about what a percentile actually is, that pop-up here associated with this question mark is going to give you some information to brush up on those statistics. So then you can see on the right side the QPP equivalent scores to that 80th percentile. So for quality, you can see that the 80th percentile is associated with the performance rate of 64.36, and for cost, the 80th percentile is associated with the performance rate of 36.14. Then we go one step further and help you understand how those performance rates are associated with a category weighting and how those ultimately contribute to your category score. So the category weighting for quality would be 45 and for cost 15, which would then calculate to a category score of 28.96 out of 45 for quality and 5.42 out of 15 for cost. Now, if you're interested in more details, you can continue scrolling down the page, and we're going to help you out to understand more details by utilizing graphs. What we do with each of these categories, the HVBP score, the quality score, and the cost score, is we help you look at the percentiles and the mapping to performance rate and then specifically call out the score that's associated with this user. At the top, we call out those high-level details, specifically the performance score and the HVBP percentile, which is how we do that crossover again. So the percentile is here, and the performance rate is on the bottom. You can see your particular scoring here with this orange dot. Upon hovering over it, you're going to see that same information that we have called out at the top. The performance rate of 54.84 is associated with a percentile score of 80. At the bottom, we're also calling out the attributed hospital, and then this mapping information section is really just a text description of exactly what I'm explaining to you right now. Now we're going to jump into the QPP equivalent scores. And so specifically, we're talking about the quality category and the cost category, and that same high-level information is called out here at the top, how we get that category contribution by utilizing the performance rate, the category weight, to ultimately give you the category contribution that you would have received, 28.96 out of 45 for quality. We have the same information of the percentile here and the performance rate, and then we specifically call out where this particular user landed with this orange data point. Upon hovering over it, you get that information of the performance rate and the percentile. And then at the bottom, similar to the HVBP scoring, we call out the attributed hospital, and then the mapping information section, again, is just a text description of exactly what I'm going over with you right now. Finally, with the cost category, we call out the performance rate, the category weight, and then finally the category contribution. And that ultimately is 5.42 out of 15. And again, that's that same information that you were seeing up here at the very top. We're just continuing that throughout the experience as a reminder. So in this graph, again, we give you the percentile, we give you the performance rate, and we graph that, and then we specifically call out where this particular user landed with this orange dot. And again, upon hovering over it, you can see the performance rate and the percentile that are associated. At the bottom, that same information of the attributed hospital, and then the mapping information section, which just describes things in text of exactly what I'm going over right now. And throughout the experience, we always give the call out of how you can get help and how you can get technical assistance. So that's always here available for you. That concludes my demonstration of facility-based scoring.
Okay, great. Well, thank you so much, Sarah. A great demonstration, getting a lot of really good questions coming through. So as Sarah mentioned, this is a good segue into our resources and technical assistance piece. On the next slide, just talk a little bit about some of the resources that we do have available to help walk you through facility-based measurements. We do have a fact sheet as well as our facility-based preview FAQs available on the resource library on qpp.cms.gov. Of course, there are a lot of general resources just around the entirety of the quality payment program and certainly the Mips track of quality payment program, if you will. But also on the next slide, just to mention that if you are just getting started and are interested in learning more about facility-based measurement, of course, we certainly encourage you to connect with us, connect with the website, qpp.cms.gov, or send your questions to our Quality Payment Program Service Center. But we also have no-cost technical assistance that's available to each of you, and it's really dependent upon the size of your practice. So I think for folks in the larger practices where facility-based measurement may be more applicable, certainly reach out to your quality innovation networks or quality improvement organizations. Of course, there are small practices also that this may apply to, so I highly encourage you to reach out to the Small Underserved and Rural Support Initiative. Again, both of these networks of free support are available and are standing by to help you through the process, and not just facility-based measurement, but all things quality payment program. Okay, so at this time, we're going to charge forward into the open Q&A portion of the session. I'm going to turn it back over to the operator just temporarily to give you the information on how to dial in.
We're going to start the Q&A portion of the webinar. You can ask questions via chat or phone. To ask questions via phone, please dial 1-866-452-7887. The number again to dial is 1-866-452-7887. If prompted, please enter ID 295-7188. Again, if prompted, enter ID 295-7188. Once you join the conference, please press star 1 on your telephone keypad to ask a question. Again, that is star 1 on your telephone keypad to ask a question.
Okay, and while we're waiting for folks to dial in, again, a lot of good questions coming in the chat. I know some of our subject matter experts are working through your questions right now. I did see a couple questions just around how will I know if I'm eligible for facility-based. Again, if you do punch your NPI into the participation status lookup tool on qpp.cms.gov, we do have an indicator built into the lookup tool at this point that will tell you if you are facility-based. And I believe it also shows you your associated hospital as well.
Yes, it does.
Okay, perfect. And then, of course, you can go over to our facility-based preview that Sarah just demoed for you, just to get a better understanding of your scores at that point. Okay, do we have anyone on the line?
Our first question comes from the line of Jason Shropshire.
Hi, Jason.
Hi, can you hear me?
Yep, we can.
Hi, can you review again? What I find confusing is I'm interested in everything at the group level. So when the person was illustrating the demonstration, how can you have, it says there's no facility preview, but then she was showing facility scoring at the individual level. How do you know if you're eligible at the group level?
Okay. Hi. So it's pretty much the same experience as you were seeing on the screen that I was sharing. When you saw the messaging that said there was no group information, in that section you would see a button to the right of that tin, and you just click on that button and the experience is going to look almost identical to the NPI experience.
You're saying there's a button if you are eligible. So if you have the little pop-up with the exclamation point that says no facility preview data is available, you cannot report at the group level?
Yeah, so that would actually go back to your association with the group. So if 75% of your group is not billing underneath of the hospital, it would not make the group eligible for this the hospital-based value reporting.
Okay, so to confirm, unless you have a button available there without this message, that's the only way you can report at the group level.
Why is he asking about reporting?
Sorry, can we just clarify just that last question for you?
Yeah, right, you keep mentioning a button, so I'm talking about if I want to report at the group level, and I have this pop-up message that says no preview data is available for this practice, individual scores can be viewed below, that means I cannot report at the group level, correct? Because I'm also missing this button.
So I think we might be getting a little confused here. We're presenting just a view into facility scoring. There's no reporting here.
Well,
yeah,
so
this is just.
I don't mean. I mean, am I eligible to report at the group level? What I find confusing in your website is that section. There's not much information about the group level. Yes or no, you're eligible.
So you would need to go through the authentication process into the qpp.cms.gov, and you can check your group to see which CCN it's associated with. If there is no CCN associated with that group, that is also utilizing reporting through the hospital-based value program. That would not be an option for reporting, in which case you would need to report through qpp.cms.gov as there is no CCN reporting numbers.
Okay, I think it would be very helpful if there was a fact sheet or something on that you published on how to, like a work through on that. That would be very helpful because I think most people are probably interested in at the group level.
And just to re-clarify, the purpose of this tool is not to check your reporting status. It's to get a preview into facility scoring. So there's no reporting whatsoever in this system. So do not use these pages to check your reporting eligibility.
Good, and thank you for that feedback. We appreciate it. That's something we can certainly look into as far as resources go. Okay, do we have another caller on the line?
Your next question is from Roxanne Brera.
Hi, Roxanne.
Hi, can you guys hear me?
Yes, we can. Go ahead.
I work for a national acute care facility. I had put the question on the Q&A. We get multiple emails from across the country from providers requesting data. And I was wondering, is there any way that we can be more proactive and get a list of providers who qualify for this measure so we can better, work with them instead of being reactive to all of their emails?
Yeah, this is Tim. Thanks for that question. We do hear that through various forms for various parts of the program. Unfortunately, there is not a means of doing that indirectly. There are more direct relationships, but they require engaging CMS with data usage agreements and a few other features to secure data from the program. We can, if you submit a service ticket with that, they will be able to provide you a response on how to get that data. But again, it requires a bit of authentication and assessment. So I would encourage you, if you can reach out to the service center, they will be able to at least start you on that path. Whether or not that's going to be approved or utilized, that will have to be determined. Hopefully that answers your question.
And you said the service center, right?
Yes.
Okay, thank you so much.
Okay, thank you. All right, we'll take our next call.
Your next question is from Amy Moore.
Hi, Amy.
Hello. I believe I was just going to add a clarification to what I understood the gentleman a moment ago asking about the group reporting. So to identify, the eligibility status, we have to look all of those providers and groups up individually. to see, again, their eligibility for the program. And then, depending on that information, we then have to look up in the facility-based preview information to see if that is a viable option for reporting. So it is, I understand where he's coming from as far as it's a two-step process and those steps may not align. And when you're involved with a large organization, that's, you know, a pretty significant lift to be able to do that for a group.
Hi. There is a more robust functionality if you log into the QPP portal for participation. It isn't limiting to just doing an NPI lookup like on the public-facing. You can do a TIN-level lookup, and I believe you can also pull down some participation lists, which should help facilitate a more efficient way to better understand your TIN level options as well as your individual level options within there.
Hopefully that helps. Okay. Do we have our next caller?
Our next question comes from Tammy Kennedy.
Hi, Tammy.
Hi. So I am actually looking at my QPP site, and so I did get the initial, like, our Carl Healthcare Incorporated facilities, like, we get the little message, no facility-based preview, yet if I scroll down into, like, the individual clinician preview scores, there is a one that says Carl Healthcare at the Carl Hospital. So it's giving me a group preview so I'm just trying to figure out what that means.
So this is something that I believe relates back to the place of service charges. So we've actually encountered this before where individuals have been seeing something like that, but if the group doesn't have the place of service charges by the majority of the NPIs, then that would mean that the group for the facility is not receiving a preview due to the fact that 75% is not reporting at the facility.
Yeah, so I get that error, but why do I get a preview for our group at the hospital?
It would be the facility that's associated with that. So if the facility has the same name as the group, it could be
different names. One is the Carl Healthcare Incorporated, so that's our ambulatory clinician TIN. And then we have the Carl Foundation Hospital TIN. And so above, for the Carl Healthcare Incorporated, which is the TIN that I do for QPP in our group, says there is no facility-based preview. But then I scroll down and I literally get Carl Healthcare Incorporated at the Carl Foundation Hospital.
Hey, Stephen, it's Adam. I think what's going to be best for us at this point is to look into the specific situation. So
okay.
I agree. I was going to say the same thing. If you wouldn't mind submitting a help desk ticket,
yep.
we would be happy to follow up with you.
Absolutely.
Yeah, and just let them know that you talked to us on this webinar so we can expedite it.
Okay, great. Thank you so much. Appreciate it.
Thanks. Okay.
Again, to ask a question, please press star, then the number 1 on your telephone keypad. Our next question comes from the line of Akila Banyani.
Hi, do we have you?
Keela, your line is open, or Sheila, your line is open.
This is Sheila. Can you hear me?
Yes. Hi, Sheila. How are you?
I'm doing good. Okay. On slide 10 at the bottom, it says determinations for the 2019 performance year are based on a claims period of October 1st, 2017 through September 30th, 2018. And it says this is the only historic look-back period that will be used to determine eligibility. What happened to the second performance period, October 1st, 2018 to September 30th, 2019? That doesn't matter anymore?
So it does matter. However, we have chosen that for the identification of the facility, that it is always going to be anchored on the first run. Similarly, we have another policy for a complex patient that is only anchored on the second run. So you still could become ineligible for the entire program with the second run potentially, but we're basing the facility-based assignment to the first run.
Gotcha. Okay, so only for facility-based, they're going to be using the first one to determine which facility to connect the provider to.
Yes, and that's intentional to allow everybody to have insight into what facility they are linked to, so that you have time to make decisions on how you want to participate. If we did it with the second run, it would be a really tight turn for everybody to have about a month and a half to prepare to report if they decided they weren't happy with their assignments.
Okay, thank you.
Thank you. All right, we'll take our next caller.
Again, to ask a question, please press star, then the number 1. Your next question is from Julie Williams.
Hi, Julie.
Hi. Just a quick question. Can we go back and revisit the comment regarding fiscal year 2019 reporting being based on fiscal year 2020 hospital value-based program scores, and kind of expound on how that works with the timeline? With it being a fiscal year 2020 impacting 2019 reporting? And my question being, physicians need to make a choice or determine whether they're going to go with the facility-based scoring or another scoring method, but it kind of sounds like they may need to do a separate reporting and then compare their scores, because they're not really going to know in advance what their hospital score is before they start compiling their data to report for 2019. Am I missing something?
Yeah, this is David, and I can talk a little bit about that. So in our rule, we finalized that for the 2019 Mips performance period, we will be using fiscal year 2020 hospital VBP data and scores. And those hospital VBP scores are the ones that affect the hospital payments from October 1st of 2019 to September 30th, 2020. We anticipate that those scores will be available sometime before August 1st of this year. Okay. That's traditionally when those have been published, so that hospitals know a few months in advance sort of what the adjustment is going to be to their payment. Okay. So we don't have those scores available yet, and so that's why they're not actually shown in the preview that you saw. But you will get those later this summer, and those will be the scores that are officially used to determine the facility-based scores for quality and cost.
Okay, thank you, and that's very helpful to know that those scores are usually available about August, but that also brings up my next question. Providers then have no way to know before the start of a performance year what their attributed hospital score is going to be, so they can't make a decision as to definitively go with the hospital value-based program quality score or to continue to report via another method. There's no way to, they're basically going to have to continue to report via another method because they won't know what their hospital scores are until later in the reporting year, especially for those who report via claims or registry, and we're sending our information in all year long, beginning, January 1 to our registries. And we were kind of hoping that the facility-based scoring was going to reduce some of the reporting burden for our physicians, but it sounds like we're going to have to continue to report via another method in the event the hospital score, quality score, is not high enough for what we would like for it to be.
Right. Yeah. So you won't know for sure what the hospital score is, but what you will know is which hospital you are attributed to, and you'll know what their score was before. Well, so it might give you some indication of whether they're kind of a upper distribution hospital or middle or lower. Now, of course, that could change from year to year. But
we've looked at their past scores, and and that's kind of what we're using as a guide. But you're right; I've looked back historically several years, and they changed. So it's
So unfortunately, that's the most recent data that we're able to provide.
Okay, thank you.
Okay, great, thank you. Okay. We'll take our next caller, please.
Again, to ask a question, please press star, then the number 1 on your telephone keypad. We'll pause for just a moment.
Okay, and while we're waiting, just a reminder, really great questions. We're getting through them on the line, plus also in the chat. We will have these materials available, the slide deck, the recording, the transcript, within about 2-ish weeks. So please feel free to check back with us, and you'll have the slide deck as well as the demo, just to kind of preview it again. Of course, there also are a number of resources around facility-based measurement that are available on qpp.cms.gov, so continue utilizing those resources. But if you do have any questions after our event today, please reach out to our Quality Payment Program Service Center, and we'll do our best to help. Okay, checking back in. Do we have anyone on the line?
There are no questions showing at this time.
Okay, fantastic. We're going to keep working through some of the questions that we have in the chat. I know we're answering them pretty rapidly at this point. So again, if we don't get to your question today, feel free to send it to the Service Center, or if there is a specific scenario that you find yourself in, you can also reach out to us and we'll try to work through that with you. Of course, we also have the free technical assistance that's available, and the organizations are available to help with a number of these questions as well around facility-based measurement. So highly encourage you just to engage with us. I think that's the best advice I can provide.
And we do have an additional question from Tracy Sanders.
Sure, great. Hi, Tracy.
Hi. I have a question. If there's a group that works out of multiple hospitals and the majority of their business is performed in one hospital, I would expect to see that hospital displaying at the practice level facility. But if there's a single clinician that does not perform their services at that hospital, would I not expect to see a different hospital displaying at the clinician level?
Yeah, this is Tim. So let me just see if I'm following your question.
Okay.
So you have a group. The group works predominantly in one place. You have a clinician. You don't know if they have the same practice pattern. So they work in one or more other hospitals, right?
Yeah, that single clinician rarely ever works at the hospital where the majority of the group business is being performed.
Sure,
but on
sure.
But on the QPP website, it's displaying the one hospital that the majority of the work is done for both the clinician and the practice level.
Yeah. So we're probably going to need to look into that one for you because there's some logic applied to the way we pull this from our national claims file, and this may be a logic consideration to make sure we validate it. This is similar to the one Stephen had raised earlier. We just need to look into it to make sure that how we're doing our matching across the Part A and Part B billing sets is meeting expectations, and it sounds like you have a use case where it's not, it is at the group level, but you have an individual where it may be either not matching according to what you would expect, or the match is not accurate fully. It sounds like not accurate. Yeah, if you want to send us a Service Center ticket so we can follow up on that, that'd be helpful.
Yep. Sure. Thanks a lot.
Thank you. Thank you.
Thank you. Okay, we're getting closer to the top of the hour, so I am just going to do kind of a last call for questions to dial in and ask our experts. Do we have anyone left on the line?
There are no questions in queue at this time.
Okay, fantastic. So again, really great questions. We appreciate everyone certainly dialing in and chatting with us today. Certainly some things that we can look at, some resources and feedback. Appreciate all the questions because this does really help us build out materials we need to help explain facility-based measurements and make sure that the experience is as flawless as possible. So we'll take all of this back. Again, highly recommend checking out some of the materials, reaching out to us again with any of the questions we have today weren't answered. Just send them to us through the Service Center. We'll make sure to try to answer those questions for you. Just going to check in one final time. We have just a few minutes left. Final questions?
Press star then the number 1 to ask a question. There are no additional questions at this time.
Okay, fantastic. Well, we are at the top of the hour. We appreciate you all for joining us today. Again, check back with us in about 2-ish weeks. We'll have the slide deck recording transcript all available in the webinar library on qpp.cms.gov. Encourage you to sign up for our listserv. We'll certainly send a message when that information is available, but it'll also keep you up to date with all things quality payment program related. I want to thank all of our subject matter experts for being with us today. Looking forward to talking to you all again soon. Thanks so much, everyone.
Thank you. This concludes today's conference. You may now disconnect. Presenters, please hold the line.